Treating chronic pain isn't always the easiest. You have this entire community of people rallying behind you. You need a patient to trust you. Those doctors who seem to do the best are the ones that can really just kind of turn off this brain and be able to open themselves up to an entirely different arena. It's just the sudden reinvigoration of, yes, now I remember why I'm doing it. Treating chronic pain isn't always the easiest thing. And I remember Dr. Olmos making a statement very early on that a lot of people who try to transition into this career usually only last about 5 years before they kind of essentially burn out. And I think having the team and the support of, not just Dr. Olmos and everybody at International, but all the other center doctors really does reinvigorate you when you feel burnt out, tired, sort of at the end of your rope, not sure if you're understanding the things that are going on or what you should be doing. And so having this circle and this family and all these support people with me really helps me when I'm feeling away, right? I'm feeling away of, I don't know if I'm doing the right thing. This sometimes is like challenging and hard. And then I get around them and it's just this sudden reinvigoration of, yes, now I remember why I'm doing it. And so having this group that doesn't just support you and mentor you from an educational perspective, but really also helps you to as a reminder of why we're doing it. When you lose sight of that from time to time, I always know too. It's funny because I always happen to know when I'm like needing that little bit of a boost from my family and my crew and my team of like, man, I just need to be reinvigorated and I need it. And that's the great thing too is, at centers we have our monthly webinars. So, we get the continuing support from, the Facebook page, from International. And so there's always this continuous amount of support that we get where really you just feel like you're constantly being boosted and reinvigorated and reminded of why you are doing what you're doing. I think one of the most obvious characteristics would be, again, just that thirst for knowledge and just the ability to open up their mindset and their mind frame and to accept a different way of looking at things and evaluating things and not just resting on this is what I know and this is what I've always known. But those doctors who really have the capability to open up, to step into that discomfort, right? To step into that not knowingness, which can be uncomfortable when you've been doing a job for, 20, 25 years or even less, right? You did it, you learned all the things. You see patients and you're pretty set in how you're treating patients. And to step into this sort of completely different realm and completely different field, those doctors who seem to do the best are the ones that can really just kind of turn off this brain and be able to open themselves up to an entirely different arena. So that's certainly one thing. Secondly to that is the patients that we're treating. You have to have the capability for empathy. You have to understand the patients that we're going to be seeing. You have to understand that when you're treating a patient in chronic pain and with sleep issues, that does require a certain amount of the ability to be empathetic, to truly listen, and to truly take in, their concerns, their complaints, their pains, their struggles, and help them work through that, because you need a patient to trust you, to trust in you, because that's how we foster a good relationship together. And once we can foster that beautiful relationship between, patient and provider, then that's where you gain that trust. And then that's where they're going to start to step into, again, maybe even different arenas that might bring a patient discomfort. So I think for a provider who is stepping into this, you have to be able to step into somewhat of that discomfort. And I think the providers who do the best are the ones who can do so willingly and, be humble of the fact that there's a whole different way of doing things and there's a whole new arena of things that we're learning. I personally would not have been able to do this, I believe, and been as successful as I am without the support of the community of TMJ International, but again, all the other center doctors that we have, because not only do you have the guidance of, Dr. Olmos, but you have the capabilities to reach out to other doctors, and you can, juggle ideas off of them or share cases or say, hey, I'm a little bit stumped here. I'm not really sure what the next move to make is. And so you have this entire community of people rallying behind you and different thoughts. It's this beautiful mind share where we have all these different brains that can look at a case and say, hey, let's try, some different things here. So it really is so important to have that community behind you and to help rally with you. And, again, sometimes just to give you a little rah-rah support, right? Like, you got this, you're doing fine, it's okay. But truly, I would have had a difficult time, I believe, with the success here in this office if I didn't have that community behind me to help me learn and to give me support and guidance and to help with patients and, kind of give me that boost that I'm on the right path. I believe the long-term vision of International kind of mimics what the vision has been all along, is we want to provide a space for doctors to be educated, give them the knowledge that they need, expand their vision to understand it's not really dentistry that we're doing, it's medicine, to open your mind to a different realm of understanding and a whole different knowledge base. But also with International, long-term vision is to bring more doctors into the fold with us so that we can mentor them and provide that support that we have found over the years so many doctors need when they're making this transition, because it is a very different transition. I don't want to use the word difficult, but if you don't have the support behind you, I would use the word difficult. And so I think the long-term vision mimics what the vision has been all along. How do we provide the education and the support for providers so that they can help more people? Our ultimate vision is we want to help more people. And the way we can best help more people is to educate more doctors to provide that support and to provide that level of care for patients in their areas.